दोस्तों, मेरा नाम है डॉक्टर राजेंद्र साहू। आई एम कंसल्टेंट पेन स्पेशलिस्ट एट किम्स हॉस्पिटल एंड न्यूरॉन पेन क्लिनिक भुवनेश्वर। आप सबको मेरा यूट्यूब चैनल न्यूरॉन पेन क्लिनिक में स्वागत है। हेलो फ्रेंड्स, वेलकम टू माय यूट्यूब चैनल। सो आई एम गोइंग टू शो यू द एक्सटेंसर compartments of the wrist. So there are 6 compartments we know. So few pathology that we come across in day-to-day practice. One is decurvence tenosynovitis of the first extensor compartment. There is something not very common, that is we call intersection syndrome. That I am going to show you here. What exactly is the intersection? There are two types. It is a proximal and the distal intersection. Intersection syndrome, and also I am going to show you the other tendons which will be useful in the context of rheumatoid arthritis or inflammatory arthropathy. You can see inflammatory fluid around the tendons, where you can probably want to do a tendon sheath injection also. So let us start. So here I am again using a high frequency linear probe. So let us start with the first compartment itself. The first compartment is abductor pollicis longus and extensor pollicis brevis. That is over the radial styloid, over this area. Okay, I'll put my probe over there. Okay, so once I do that, have a look here. This is the orientation marker. That means in the screen, orientation marker points towards the dorsal side. Okay, so this is the dorsal and this is the ventral side. One can see that is the styloid of the radius. So there are two tendons on the top of it. The bigger abductor pollicis longus, the smaller is extensor pollicis brevis. The two tendons are very nicely separate and we can see the tendon sheath on the top. Okay, whenever there is a decurvence tenosynovitis, that tendon sheath will be inflamed. There will be hypoechoic fluid around it. So this is the first compartment. This bigger tendon is abductor pollicis longus, the smaller is extensor pollicis brevis. Okay, if you see posteriorly, that is a vein that is kind of compressed there. The superficial branch of the radial nerve, that is there, that lies exactly in the top of the vein. It crosses over like that. Okay, so superficial radial nerve I will show in a separate video. So that is the first compartment. Slowly moving further dorsal, one can see another two. So that is extensor carpi radialis longus and brevis. That is the second compartment. Further moving, this is, you can see a pointed tubercle. Did you see that? That is called Lister's tubercle. Have a look here. So that is a Lister tubercle. Some people find it very difficult to identify the radial styloid, which is first and second compartment. You can start it from here. So instead of here, first compartment, move here. You can feel for that prominent mark, that is called Lister tubercle over here. So that separates the second and the third compartment. Put a probe over here. So what you see here, that pointed bone, that is the Lister's tubercle there. The ventral or the anterior part is extensor carpi radialis longus and brevis, that is the second compartment, and this is the small tendon here, that is the extensor pollicis longus tendon. Okay, so that tendon on the other side of the Lister tubercle, that is extensor pollicis, is a very small tendon. That tendon, that is Lister tubercle, the small tendon. Moving further dorsal, this is the fourth compartment. Fourth compartment, that is extensor digitorum or indicis there. You can see the tendon sheath nicely, tiny amount of fluid over there. As I move further, extensor digiti minimi, and this is the sixth compartment, extensor carpi ulnaris, sixth compartment. Okay, so sixth carpi ulnaris, digiti minimi fifth, extensor digitorum is the fourth. Moving further, third is your extensor pollicis longus, the small one there, extensor pollicis longus. This is the Lister tubercle. This is the second compartment, extensor carpi radialis longus and brevis, and then this first compartment is your abductor pollicis longus and extensor pollicis brevis. Whenever there is a, this is the first compartment, you can see those two tendons. Whenever there is a decurvent stenosynovitis, we do the injection from here to here. Put the needle from here for a decurvent stenosynovitis just below the probe actually, and target on the top just below the tendon sheath. There we go from this side to this side. So after knowing how to scan and identify the 6 different extensor compartment, now I am going to talk about the proximal and distal intersection syndrome. So proximal intersection is, by the way, more common than distal intersection syndrome. Sometimes patient may come and tell you, see, here is the pain for the decurvent stenosynovitis like this. You do a Finkelstein test. Finkelstein test is going to be painful here. 7 to 10 centimeter proximal, if patient complain of pain over here, then you possibly think of an intersection. What happens? The first compartment is little dorsal. It comes like this and crosses over the second compartment to go it here. Have a look how it looks like in ultrasound. Okay. So this is my first compartment. I'm just putting a pointer. So this is the first compartment tendons. This part is posterior or dorsal, this is anterior. So this is the first compartment. As I scan proximal, have a look, this compartment, this is the proximal compartment, the first compartment that goes, see that is going over the second compartment, that is the second compartment. So it crosses over and goes, this is dorsal part. So now those are the muscles of the first compartment. I just scan distal. Have a look. So this is the tendinous part of the second compartment. This will just cross over and will come to this side as I go distal. See, this is crossing over, going to distal part. Now you can see this is the first compartment, abductor pollicis longus, extensor pollicis brevis. This is the second compartment. Now they are kind of like a railway putty, they are crossing. So this is now just going proximal, coming to the dorsal side. Now this is muscle, more of muscle, small myotendinous, slowly going, it is crossing to the other side. I hope you are able to appreciate. This is the second compartment, this is the first compartment. Can you see that? Second and the first compartment going proximal, crossing. So this is where the exact crossing happens because of friction, overuse, strain there. So that is where the pain happens. So you have to inject there between the first and the second compartment, exactly in the plane between these two compartments in patient with proximal intersection. Have a look here, that is where the intersection is happening, which is around 7-8 centimeter proximal to the normal position. That is where the pain happens. Okay. So again, one more time, first compartment, second compartment. So this is going proximal, the first compartment goes to the other side like this. This is the second compartment. As I come distal, now it is going. So that is the proximal intersection syndrome. Now I am going to show the distal intersection syndrome. In distal intersection, the third compartment crosses over the second compartment. Have a look. This is your lister tubercle. This is the extensor pollicis. This is lister tubercle. This is the second compartment, and this is the third. So as I lister tubercle, I slowly go distal. Have a look. This is the extensor pollicis longus. This is crossing over the second compartment. The small tendon extensor pollicis is going. I am going distal actually. So I am going distal. So from here, as I slowly go distal, one can see the third compartment tendon. This is the lister tubercle. This is third compartment. So you have to change. Little bit of subtle angulation is needed. Lister tubercle. Now this is the third compartment. As I go distal, that goes over the, as scanning here, that goes over the, see here, that small tendon goes over the second compartment, that is going over the second compartment, this one. So this is the distal intersection syndrome, not very common. So thank you for watching this video. I hope you are able to correlate with all those extensor compartment tendons, the common pathology that we come across in day-to-day practice, the intersection syndrome, specifically the proximal and the distal intersection, how they kind of crisscross each other, the tendons, and that is where the pain happens in some patients. So if you know that, in normal patients you can do a guided sonography guided injection accurately. Thank you.